is Dr. Jones. Lovely to meet you. I believe this is your second day aboard the spaceship, is that correct? Yeah. So, yesterday you must have had a brief introduction to life aboard the spaceship, is that correct? Yeah. Well, I am going to be your designated doctor whilst you're on board the ship. So today I'll be giving you a very quick introduction about things from the medical perspective, as well as running one of the tests that I need to run on you. Okay, so as I'm sure you are already aware, we are aboard this spaceship for roughly 360 years. The vast majority of that, though, we will be spending in a state of cryosleep, so we won't even notice the vast majority of that time pass by, thankfully. I think we are all active aboard the ship for about 3 years in total. It's not going to be in one block, but rather a few separate segments of time, and I believe this is to help us navigate the more dangerous regions of space. But there's no need to be concerned. The spaceship is well staffed with a wide variety of experts, and I'm sure that we will safely arrive at our destination, the new planet that we are hoping to colonize. So that should be very exciting when we arrive. A few notes for you whilst you're living aboard the spaceship. I would like you to take particular care and attention to these points in terms of your health, okay? So what I would like you to do, the first thing I would like you to remember is to go to the gym about 3 times per week. 2 to 3 times per week should be fine. And I would like you to focus on resistance-based training, so strength training essentially. This is particularly important whilst we're aboard the spaceship, because there are going to be times when we're exposed to lower gravity, so less than typical Earth gravity, and during those periods of time we may experience muscle atrophy, a loss in muscle mass, and we may experience a loss in bone density as well. That one is particularly concerning. So in order to combat this, I do encourage every single person on the spaceship to go to the gym, the onboard gym, 2 to 3 times per week, and to focus on strength-based training. You don't have to do anything crazy, you don't have to become a bodybuilder, but just a little bit to maintain muscle mass at the very least, and bone density, very important. And the second major point that I like to tell everybody is, please do make sure that you take all the supplements that are provided to you whilst you're aboard the spaceship. And this is of course because the food that we will be eating aboard the spaceship, it's not perfect, it's not the most nutritionally dense food possible. In fact, a lot of it is dry freezed food, long life food. It's not ideal in the least in terms of nutrition and health, but if you take all the supplements that you are given every single day, you'll be absolutely fine. So those are the only 2 points that I really encourage everybody to remember and to focus on for their health whilst they're on board the spaceship, is just go to the gym 2 to 3 times a week and take all your supplements. Okay, so what are we going to do today? Well, I have a large number of tests that I need to run on you and all other personnel aboard the ship, just to get a general understanding of everybody's health and to maintain their health whilst they're here. I'm obviously not going to do all these tests in just one session. In fact, I'll keep things pretty short. I think each session should last about 30 minutes maximum, I think. I believe today we shall do the cranial nerve exam. It's a favourite among the patients for some reason. I think it may just be the relaxing nature. exercises for you. And yeah, no need to be nervous or anything like that. Okay, so before we actually begin, is there anything you need? A glass of water, a quick break? No, all okay? Okay, so we'll start off, and the very first thing I need to do is just to ask you, I believe, 4 questions. Okay, so these 4 questions are just to help me to get a very general understanding of your health to begin with. Okay, so first question, what are your medical and surgical histories? Okay, thank you very much for that. Our next question, what prescription and non-prescription medication do you take? Okay, thank you. Next question, what allergies do you have? Any allergies at all, even food ones I'm interested in? Okay, and our final question, what is your smoking, alcohol and drug use history? Okay, thank you so much for answering those questions for me. That is all finished now. So we're actually going to start the cranial nerve exam itself now. I'm going to pop on a pair of gloves just to keep things nice and hygienic, of course. And I'm just listening to your heartbeat to begin with, okay? So there's no need for you to do anything in particular. Okay. Sounding very good. Good steady rhythm, good rate, good strength as well. Very good. Now I'm just going to place this on another location on your chest, and for this one, if you could take a deep breath in for me, please, and out. Very good. Just going to move stethoscope to another location. Same thing, please. Deep breath in. Out. Excellent. Same thing now to the other side, please. Okay, very good. Again, I'm just applying some gentle pressure, trying to gauge your strength. Okay, so if you could tilt your head backwards like that, very good. And if you could tilt your head now downwards, please, against my hand, very good. Okay, so for this next part, I'm going to be popping both my hands on your shoulders, and I'd like you to shrug your shoulders upwards for me, please. Yeah, very good, just like that. Okay, if you can hold your arms out straight for me, please, both of them. Very good. I'm going to place my hands on top of your hands. I'm going to be pushing down. I want you to raise your hands upwards, please. There you go. Very good. Now, placing my hands underneath yours, and if you could push downwards, please. Very good. Pushing my hands on either side of yours, if you could push outwards for me. Excellent. And the same thing, but now if you could push inwards for me, please. Very good indeed. Okay, we have come to the slightly fun section of today's cranial nerve exam. I have for you 3 artificial flavors, and I'm going to be giving them to you blind, so to speak. You won't know what flavors they are, and I want you to identify the flavors for me. Okay, so just shaking up the first flavor. Okay, so if you could pop out your tongue for me, please. Very good. Just going to drop a little bit on there for you. And what flavor do you think that is? Pineapple. Very good, very good. Okay. Going to move on now to taste number 2, 3 in total. Okay, let's have a look at how you will do with taste number 2. Okay, same thing. If you could pop your tongue out for me, please. Very good. scent. Actually, I believe this one is very easy to identify, in fact. If you would like to smell that one for me, please. What do you think that one smells like? Coffee, exactly. There we go, 3 out of 3 smells correctly identified. Excellent job. Okie dokie, let us take a look at those ears now. I think I'm just going to be using an otoscope to look into each of your ears. Obviously I'm going to be placing this inside the ear canal ever so slightly, not very deep at all. Shouldn't be uncomfortable or anything like that. Okay, so I'm just going to do that now. Take a look at this ear here. Okay. Okay, a little bit of a wax build-up in that ear, nothing too excessive. I will check the same now in this ear as well. Okay, it's good. Plug that in there. Excellent. There it is. Excellent. Okay. Okay, looking very similar to the other ear. A little bit of wax build-up, but nothing too excessive. Okay, what I want to do is a rudimentary hearing test, so to speak. What I'm going to do is I'm going to click my fingers. A little bit difficult with the gloves on, but you should still be able to hear it nonetheless. And I want you to close your eyes for me, please, and I want you to identify which side it's coming from. Okay, so right or left. Okay, so here we go. Very good. Very good. Okay, I'm going to do 2 clicks, and I want you to tell me which one is louder, first or second. Okay, so here we go. First click. Very good. Second click. Which one was louder, the first click or the second click? Okay, very good. And we will do the same in the opposite ear. First click. Second click. Okay, so which one of those 2 was louder, the first or the second click? Okay, very good. Okay, what I would like to do now is I'm going to wiggle my fingers and I'm going to move them further away from your ears, and I want you to tell me when you can no longer hear them. Okay, so we'll do both ears to begin with. Let me know when you can no longer hear this, okay? Very good. Just the one ear now. Very good. On to the other ear now. Very good. And we'll repeat it just for accuracy. Okay, so here we go. Very good. Once again, other ear. Very good indeed. Now I want you to once again identify which direction the sound is coming from, left or right. I'm going to be using something different to my fingers this time, so the sound will be a little bit different, and we'll do it a little quicker than the last time as well. Okay, so which side is this sound coming from? Very good. Very good. Excellent. Good. 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 Very good. 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 Okay, now I'm going to whisper a few numbers in each of your ears, and I want you to repeat back to me, please, the number that I whisper into your ear. Okay, so we'll start doing that right now. 6. doing something known as the finger wiggle test, okay? Very advanced test in the cranial nerve exam set. Basically, I want you to focus your eyes on my nose, please. And what I'm going to do is I'm going to wiggle one of my fingers, okay? Might be left, right, might be both. If you could tell me, please, which finger, left, right, or both, wiggles. Okay, so here we go. Good. 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 Just moving them slightly. Good. 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 Moving them a little. Good. 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 Excellent. Very good. Moving them. What's a little bit? How's that? Just observing your eyes as you do this. Very good. Okay, excellent job. What I'm going to do now is I want to mark the edges of your peripheral vision, so to speak, okay? So for this, once again, I need you to just continue to look at my nose. What I'm going to do is I'm going to move my fingers in various directions, and I want you to tell me when you can no longer see my fingers, okay? Very good, here we go, we'll do that now. Excellent. Good. Good. Good, okay. Going to be doing this quite close to your face now. Good. 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 I'm going to be taking a step away from you and doing the same thing, okay? So. Good. 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 Very good. Okay, and now I'm going to flash up a number of fingers in your peripheral vision. Still, I want you to only look at my nose, please, and I want you to tell me how many fingers I hold up, okay? So, here we go. Good. 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 Very good. 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 Very good. And now I'm going to be doing a very quick test for double vision. Okay, so what I'm going to do is I'm going to move my finger closer to you and further away from you, okay? I want you to focus your eyes on my finger as I'm doing this. Okay, and I want you to take notice of whether or not you see two fingers. So double vision is what we're looking for here, okay? I'm going to do this a couple of times. How many fingers are you seeing? Just the one. Very good. Okay, that actually concludes our cranial nerve exam today, and I must say you have performed very well throughout, followed all my instructions perfectly well. Thank you so much for being so attentive, for being so patient with me on our first meeting today aboard the spaceship. Okay, so as I mentioned, if you have any problems or any questions regarding your health whilst you're aboard the spaceship, please do not hesitate to come and contact me. Ask me any questions you would like any time that I'm in the office. That's no problem at all. Okay, so we'll discuss your